Thank you for joining us today for this webinar. I am Kent Chesky, and I serve as the Executive Vice President and CEO for the Council for Agriculture, Science, and Technology. We are pleased to be sharing our most recent CAS special publication on zoonotic diseases in animal agriculture and beyond, a One Health perspective. As noted on the agenda, we will have a question and answer session with a panel of the authors from this paper's task force after our main presentation, and we'll open up the chat box for questions related to this topic a few minutes in advance. CAST is a nonprofit 501c3 membership-supported organization comprised of scientific societies, companies, nonprofits, universities, libraries, and individual members. CAST was established in 1972 as a recommendation of the National Academy of Sciences National Research Council. CAST board is comprised of representatives from scientific societies, agribusiness, and nonprofit organizations. It is through our network of experts and supporters that we select the topics for our CAST papers and access volunteer scientists, economists, engineers, and other subject matter experts who help produce these papers. Over the last 15 years, over 1,500 professionals have graciously volunteered their time, energy, and expertise to serve as an author of our paper or as a reviewer to ensure each is unbiased and based upon sound science. I'm excited to share that CAST is marking its 50th anniversary, commemorating half a century of communicating the science, the technology, and the innovation so critical to the future of agriculture, food, and natural resources. Today's webinar is being recorded and will be available later through our website. Toward the end of the presentation, we'll post a message that the chat box is open for you to submit questions to our panelists. The task force chair for this paper is Dr. Lonnie King, Dean Emeritus of the Ohio State University College of Veterinary Medicine. An expert in One Health and zoonotic diseases, Dr. King has successfully advocated for important legislation and coordinated teaching, research, and outreach among Ohio State's 7 health sciences colleges. At this point, it is my pleasure to turn the program over to Dr. King, who will lead us through presentation of some of the key information in this paper. Thank you, Dr. King.
Well, Ken, thank you very much. It's a pleasure to be with everybody this afternoon. And before I get started, let me acknowledge the authors on this publication that you can see on the screen. I won't go through all of them. They've been terrific. They're wonderful experts, and we really appreciate all their hard work in putting this together. I also want to acknowledge and appreciate the reviewers, the CAST liaisons, and also to Kent and his terrific staff at CAST. They've been wonderful to work with. And a special acknowledgement to Megan Wickham, who I've worked with pretty closely over the last year or so, and she's been wonderful. So with that background, and let's see if we can. Andy, you want to turn this over to me? And do you want to go ahead and shift these then, and so we can get started? I don't really have the remote on these. Okay, so thanks very much again. And as you take a look at this publication, and please, you have an opportunity to download it free, which makes it special. And I appreciate CAST being able to do that. So think of this publication as a book, if you will. And the first chapter of this book is really about 3 historic epidemiologic transitions that have been very important in infectious diseases and zoonoses. That first era started 10 to 12,000 years ago, and that happened with the advancement and advent of agriculture, where people went from hunters and gatherers to more stable communities where they were able to transmit diseases back and forth. They lived closer together. And the other important event was the domestication of animals. So it was the first time that we really saw a number of diseases that came from animals to people because of that interface and connection. The second epidemiologic transition really occurred much later on, and it really was a time of industrialization where we had better sanitation, longer life expectancies. Antibiotics started to play a role in this, and for the first time, we started to see a decrease in the mortality of infectious diseases. And it was even thought early in the 1970s that the era of infectious diseases were over, and that, of course, was very premature. And that's led to the third epidemiologic transition, which we are part of right now. And that transition really probably started in the 1980 and 1990. So we'll talk about why that happened and why that transition took place. But from 1992 forward, there was an increase of about 58% of mortalities on the infectious diseases. So it was obvious that this was a new era and a new start. And what was different about this was that there are new drivers now in place that are really important, that staged this new epidemic. Next slide, please. So we ought to think about these and as a group of factors that came together to create a perfect microbial storm. And this perfect storm was due to a number of factors: biological, physical, environmental, ecological, social, political, environmental factors that gained momentum and were accelerating. And they created the perfect storm, if you will, for the microbes in the center of that storm to kick out a number of new emerging infectious diseases. So this was called the convergence model. And the metaphor of this perfect storm, I think, is right. And this was the time then that we saw this major increase in zoonotic diseases and emerging infectious diseases. Next. So at that same time, about 2003, there was a very important publication that came out of the National Academies of Medicine, Microbial Threats. And it really was talking about the factors then that really had come together to create this perfect storm. And that publication listed a group of factors that are really anthropogenic factors. These are factors created by us, by people themselves, that have created this perfect microbial storm. They're about human demographics and behavior, technology, industrial changes, economic development and land use, international travel, commerce, the ability for these microbes to adapt and change and to move, the breakdown of public health measures worldwide, climate change. This was 2003, and people were still starting to worry about climate, effective weather on emerging diseases, changing ecosystems, poverty for sure, war, famine, the lack of activity or the lack of political will, and the intent to do harm. And if you look at these from 2002 to the next decade, 2012 to today, just kind of subjectively look at this, and for each of these factors, they have either stayed the same or have accelerated or intensified over the last 20 years, meaning that these factors are in place, and what we need to expect, unless we change our activities, we will expect more pandemics and of greater consequence. Next. So those of you that are been in Washington, or the next time you're there, well, take a walk past the National Archives and you'll see two magnificent statues out of the entrance of the National Archives. And the statue on the left is a picture of an old philosopher that's looking down the past. He's considering what's happened, and he's contemplating the past. The book on his lap is closed, and he is telling us to study the past, learn from the past, learn from those lessons as we move into the future. And we'll talk more about that, and we really have not learned the lessons very well. The statue on the right is a younger woman who is peering into the future. Her book is wide open as she will be writing the future as we move ahead. And the statue says, "What is past is prologue." And that certainly comes from William Shakespeare, the Tempest, in his play, a very famous quote. And she's contemplating the context of our world today. And as she has yet to write the future, she knows that the past is prologue. These events that have taken place will shape our future, but we're not predestined. And this publication is really talking about what we can do so that we aren't predestined to a future of just more pandemics and more zoonotic events as we move forward. Next. So we know that what we see in pandemics and zoonotic diseases are not obviously just in the United States. They're very much global events, and that's proven out over the last 2 or 3 decades. And we know a threat anywhere is a threat everywhere. These last 20 or 30 years have been a great 21st century mixing bowl of people, of animals, of products, of changing environmental conditions. And this mixing bowl now has, like the convergence, has created new opportunities for microbes and new opportunities for zoonotic diseases to come forward. So today we know our world is complex. It's certainly fast-paced. It's crowded. It's getting more crowded. It's warming, as we know. It's unbalanced. It is greatly interconnected. Our ecosystems are eroding mainly because of what we are doing to them. And I believe, and many others, that we are profoundly unprepared for the next pandemic, even though that we are hopefully ending or going through COVID. So outbreaks can be, unfortunately, part of our faded memories. And we sure know that they're going to occur with greater frequency or consequences, unless we write the future differently than what we know today. Next. So the microbes that are part of this convergence and in this microbial perfect storm have great advantages today, especially over the last 20, 30 years. We now know that 60% of all human pathogens, which we know about 1,500, are zoonotic. And 80% of all animal pathogens themselves can be spread amongst animal species pretty readily. And that's 75% of the new human infectious diseases over the last 2 to 3 decades are zoonotic. We know of at least 250 zoonotic diseases, and I think we could probably put a 0 on that for what we don't know. It's become a greater part of our world and really an existential threat. We believe there's something like 1.6 million viruses circulating around in both avian and mammalian species, of which we probably know of about 1%. Recent studies have shown that the COVID outbreak now has actually infected back and forth moving 23 different species have become infected or have exposure to this coronavirus. So the ecologic journalists, the microbes that can move and shift and adapt, are the winners. We call this the microbe Club Med. They're the happiest they've ever been. They can move around the world faster than their incubation period. They can infect multiple species, and they have the ability to change very rapidly and readily. Next. So for some of you on our website today and our webinar, just to kind of go back and review, when we talk about zoonoses, it's those diseases that are transmitted from animals to people. So a pretty simple kind of definition. COVID-19 are one of those, and as we said, 75% of the newly emerged infectious diseases are zoonotic. And this is from CDC, who believes that there's an estimated 2.5 billion cases of illness, zoonotic diseases, 2.7 million deaths worldwide every year. And that's a pretty phenomenal statistic that we've seen over the last 2 or 3 decades. Next. So CDC has put together a working definition of One Health. And we're going to insert the idea of One Health right now, because we know now the complexity of these emerging infectious diseases. We know that animals are involved, our ecosystems and environment are involved. Agriculture is involved, not only in animal agriculture, but also in crops and as well. And so you can't look at one of these single domains any longer and really understand emerging zoonoses or emerging infections without looking at all of them collectively. So CDC has a definition of One Health, which is now the platform or the approach that we know is best to tackle these very major health challenges that we face. One Health is the concept that addresses complex challenges to promote the health and well-being of all species and the environment through the integration of relevant sciences at the systems level. Next. A colleague in Ohio State, Amanda Berrien, had put this Venn graph together, and it's a dynamic that looks at the dynamics of One Health. And when you look at this in 2 dimensions, it really doesn't give you the right explanation. If you look at each of these domains, human health, animal health, environmental health, and plant health, think of these as big balloons. They're moving constantly, they're pushing, they're pulling, they're integrating, and they're changing the interface with different kinds of possibilities. So think of this as a 3-dimensional diagram, if you will, where new dynamics are changing constantly. I think of this as kind of Newton's law of motion. For every action, there's an equal and opposing reaction. So if you push on environmental health and our ecosystems and the degradation of those systems, it impacts animal health and human health. And same with the other domains. So we can't look at these singularly any longer and really understand and explain zoonotic diseases and to get a hint about what new interactions or new interventions that really need to take place. This is complex and it involves plant health. We know that plant diseases are emerging and spreading, and there are spillovers that are taking place there that impact our food supply and food insecurity. So this is an ever-changing dynamic of which this One Health approach then is saying you need to understand all of these dynamics. And when we intervene to change our activities to prevent zoonoses or these emerging infections, we need to include strategies in all of these as we move forward. Next. So let's just take a really quick look at kind of what's happening in these different domains. In terms of humans, greater migration and translocation around the world of human populations is unparalleled. We've not seen this before. Major growth in urbanization, and the fastest growing populations in the world are unfortunately slum populations, where it is the perfect environment for the emergence of new infections and certainly new zoonoses. The population growth is occurring in the lower and middle income countries, not in kind of the United States and Canada and some of Western Asia. We are exposed to wildlife and vectors in levels that we've never had before. And next year, there's an estimate to be 1.6 billion global travelers in 1 year. So this means people are moving constantly, can transfer infections. And this really doesn't talk about the billions of pounds of produce coming out of our agriculture systems that are also moving very rapidly. There's a shift in preference for food as people gain some wealth, and that's a relative term. They are moving toward, and their preference is food and proteins from animal sources. Great disparities because of poverty and the interface of livestock and their animals, especially in the people with lower incomes. So just earlier this week, we have now passed 8 billion people on the face of the planet. So we add probably over 1 million people on the face of our planet every week. And with a study that came out of the International Livestock Institute in Africa and in agriculture, they believe in their study that 2.4 billion zoonoses occur just in Africa and Southeast Asia every year, with 2.2 million deaths. And 1 out of every 7 livestock that they keep are also infected, debilitated, or die, or reduce their productivity. So this is the bottom 1 billion in terms of socioeconomic categories. And it's the very group of people that are most dependent on livestock and have the closest interactions with livestock, and unfortunately then are victims of more and more zoonotic diseases moving forward. Next. So this is just a reminder, and it's a good reminder, is that people around the world are certainly at different poverty levels. And poverty is absolutely a key to emerging infectious disease, not only to health disparities, but to the number of these diseases that occur. So if you take a look at this, about half of those 8 billion people live on between $5 and $10 a day. Pretty incredible when we think about that, but that's what it is. So zoonoses is both a cause and a result of poverty. So it does keep people from moving into other socioeconomic categories. Next. So this is just the diagram that's come out of the World Economic Forum. That's the reference for this. And it takes a look at global demand for protein. And from 1980 projected into 2030, where they project maybe 700 million tons of meat products that'll be reared and distributed worldwide. And they have tracked this, and they believe that last year there was somewhere between 50 and 60 billion livestock and poultry reared and slaughtered globally. So that's at any point in time, there may be 20 or 30 billion. But if you look across the year, 50 to 60 billion, think about that, livestock and poultry were reared. And they believe by 2050, in order to keep up with the demand for food, that the world is going to have to produce 120 billion animals, a 240% increase. And that will be especially a burden on socioeconomic groups in the lower income, and the groups that we really worry about having an infrastructure in place to prevent zoonotic diseases, to detect them early, and to respond to them. So past this prologue. So this is going to be part of our predestiny? Are we going to be able to make some changes? Are we going to do this with conservation, with sustainability? And how are we going to make these adjustments moving forward? Because if this scenario continues, the number of zoonotic diseases will also increase, and will their consequence. Next. So just think about the food then. If 1 million people are joining the face of the earth every week, and we project that to be probably the case for the next 4 decades, it's estimated that we need to produce through our agriculture systems more food in the next 40 years than during the last 500. You imagine, how are we going to do that? How are we going to sustain our ecosystems and our agricultural world? How are these going to be distributed? And there's a real challenge then as people demand more protein from animal sources, and this historic increase in these animals, insecurities of food, certainly more zoonotic diseases, and the potential, even though that there are more zoonotic diseases, we also see the emergence of diseases just in livestock, passing them back and forth in livestock, or in crops and in vegetables. So transboundary diseases are those diseases that move across international boundaries. So things like African swine fever or foot and mouth disease can go a long ways to causing global food insecurities if we're not careful. And it's going to be part of our scenario in addition to zoonoses. Next. So the environment is kind of, I think, the part of the domains of One Health that we've kind of left behind. This domain really, I believe, is, in my estimation, underappreciated, understudied, and underfunded. It's a new recognition, however, of the criticality of the events to our environment and our ecosystems, mostly done by ourselves, right, that are changing our environment and ecosystems that favor more emerging infectious diseases, the interface of animals, wildlife, and people. And then when you add to that climate change, which is going to dramatically change our environment for infectious diseases, water contamination, changing land use, extraction industries, the degradation of ecosystems worldwide, and this continuing movement of people into new areas, and the interface and the possibility of then through products, animals, wildlife, domestic animals, starting a brand new zoonoses and a new outbreak. Our agricultural systems are changing. Biodiversity loss is extensive and unparalleled. So we really need to do more about not only studying these environmental domains, but actually making huge changes in our behavior and into our activities. There's some good chapters in this publication on foodborne diseases, on waterborne diseases, on vectors, and on ecosystems themselves to kind of give you a better idea of what's taking place today. So we know that, you know, there's probably 1 out of 6 people in the United States every year will get a foodborne illness through contaminated food, and many of those are because of zoonoses. 1 out of every 44 individuals in the United States every year will have a waterborne illness, and these are trending upwards as we understand then that these zoonotic agents can be transmitted to people in different ways. Next. So this is just to take a quick look of the importance of vector disease, and we're especially concerned about this, you know, as we engage and experience climate change, and how the climate change will change our epidemiology and the complexity of these vector-borne events. So the CDC has estimated from 2004 to 2016 that tick-borne diseases have increased twofold. We found 9 new diseases that we hadn't seen in the United States for the first time. And during the same time, there's a 3-fold increase in all vector disease. So pretty remarkable. And the one I would like to look at it is Lyme disease, Borrelia burgdorferi. And we now estimate through CDC about 300,000 new cases every year. And it is one of the top vector-borne diseases globally. So it is moving around the world. The chart at the top, it's hard for you to read, but if you look at the top one that is in color, that takes a look at the vectors and the potential for Lyme disease from what we know in the year 2000 to 2040 to 2070. And then just take a look at the advancement of Lyme and the ecological conditions in Canada, which we thought was a fairly cool country, cold country, and but the vectors continue to move, and they are having rapid increase in Lyme disease. The picture below is the picture of the Asian longhorn tick, and that is a tick that came into the United States we've never seen before, was not part of our tick ecosystem, if you will. Came in the United States and the East Coast, is moving. It's already into central US. I know we have it here in Ohio. It transmits anaplasma, ehrlichia, babesia, tularemia, Rocky Mountain spotted fever, and it also transmits other livestock diseases. So because of the introduction of a new vector, we now are changing the geographic mapping of these diseases. Next. So in 2017, the federal government agencies came together and they wanted to take a look at prioritizing zoonotic diseases so that they knew that they could be better prepared, that they could establish a research agenda that was consistent with these threats or priorities. They came out with these 8 top zoonotic diseases as their priorities. And if you look at the top one, it's influenzas. And in our publication, you'll see 2 nice short chapters on swine influenza and avian influenza. And they're really good summaries of what's happening. And as our federal agencies believe, that's probably the top prioritization. Through Salmonella, West Nile is as temperatures increase, and of course the emerging coronaviruses that we all know about. Next. So where are we today? So you can remember the young woman looking into the future, trying to figure out how to write the next chapter, if you will. So I think that the warning lights are blinking red. This is an unprecedented time. The drivers and factors that are creating the perfect storm and the convergence of these factors are accelerating, they're intensifying, and they're being magnified. Outbreaks will be more frequent or more consequential if the last chapter we write is not different. And these are sometimes referred to as wicked problems. These are problems that are so difficult that they don't have yes or no answers. They're societal problems, they're complex. And the key thing about wicked problems, of which emerging zoonoses are, is that past solutions no longer work very well. So that means that we need to innovate and move forward with new types of activities to these challenges and how to address these challenges. We're still poorly prepared. Certainly the low and middle income countries are especially vulnerable, and without building up their infrastructures and their capacity, they're going to be at risk. And when they're at risk, we're all at risk. So we also know that agriculture has some vulnerabilities, and we'll talk about that in just a few minutes. And I like the book, it's called Predictable Surprises. So we know what a surprise is, but we should not be surprised by the next emerging zoonotic event or the next pandemic, because it will occur. And the idea now that it's a predictable surprise means that going through these, we've kind of lost our memories, if you will. We move on to the next problem. We don't have lessons that we've learned, and we're not making changes. So the prologue is the past is prologue, and are we going to continue down that pathway to the future? Next. So we think about it. We know then with these new zoonoses and more morbidity and mortality that they're a huge burden on populations. But there's more than, and they measure these through disability adjusted life years, but there's more to it than that. We're going to create more poverty, more hunger, less clean water, less sustainability in our communities. Climate actions are going to increase. Our institutions are being challenged. And so the United Nations Development Goals of 2030 are also at risk, in addition to the disease, morbidity, and mortality. Next. So the last part of this publication, after looking at these different vignettes from these wonderful authors, is not only to understand zoonoses better, but to be able, with that understanding, to put together new interventions. And that's what we were talking about, what we're going to do. So next. And as we do this, this is kind of an oversimplified diagram, but I like it because it reminds us the importance of thinking about zoonotic diseases. So if you look at this chart, it comes out of the World Health Organization. We know what an epidemiology curve is. That's tracking the number of cases of diseases and over time. And so the epidemic curve of infectious diseases, have the ups and the downhill and the downward slides, and they all go through that. So without any actions, we see an outbreak in animals, we see the amplification, the big curve, and then it moves into humans. And you get more cases, and when they go from human to human, you get huge numbers of cases over time. And that's kind of the transition over time of a typical epidemiology curve for zoonotic disease. Next. But what we need to do is to start looking into the future and look at these epidemiology curves in terms of, well, how do we reduce them? How do we prevent these from happening? And One Health is actually a prevention strategy or approach. And it moves our thinking and our actions upstream, because the most effective action might be in changing our environment or landscape. It might be on vaccinating animals. It might be on biosecurity. So moving things upstream can prevent or mitigate these epidemiologic events in people. So if we forecast, if we're ready, if we can advance our knowledge and working with our data early on, we can mitigate and reduce not only a zoonotic disease in animals that become zoonotic, but then the transition. as it spreads from animals to people, we can mitigate that curve for humans, and we can do a better job of controlling them because we have more time and we're better prepared through rapid response. So just kind of think about that kind of a simplification of why it makes sense to kind of move upstream. That's the most cost-effective way to do this, not just count number of human diseases in hospitals. Next. So we need to rethink, we need to reimagine and reinvent our future. And One Health is going to help do that as we look for new innovations and a commitment. So I always like this quote from Albert Einstein. He said, "We can't solve today's problems using the same thinking that we used when we created them." So that means these wicked problems and past solutions don't work. Rethink, reimagine, and reinvent. And the Shakespeare quote that we all talk about, "The past is prolonged," is only part of the quote. And the rest of that quote is, "Become in your and my discharge." Next. And the end of that quote is talking about not only is the past prologue, but what Shakespeare says is what to come. And your and my discharge, meaning the future really is dependent on our behavior, our activities, our interventions. The past is prolonged, but it doesn't have to predict the future because we still have that opportunity to make those changes. I've always liked this quote from Larry Brilliant, who said, "Outbreaks are inevitable, but pandemics are optional." So what is it that we can do now that to break the cycle from moving into outbreaks, of which we know there are 4,500 zoonotic outbreaks that we know of in the last 15 years, to keep them from breaking into pandemics? And we're going to need to change our thinking and organizations through these 5 recommendations. Next. And I'll quickly end on these recommendations, and those are in the handout, and you can take a look at those. And hopefully these are what will lead to behavior changes and kind of new events as we move forward. So one is changing the narrative. And a narrative really is the capacity to justify and legitimize a cause, to become a source of power, to become a source of influence, and to drive change. And that narrative on emerging zoonoses is not one that there's something that happened far, far away and it doesn't happen very often. The one now, it is part of our national security. We know that. Pandemics are more consequential and more expensive. COVID is going to probably approach a $20 trillion event. So, and there are impacts beyond health. It's across all dimensions of society and changing our way of life. So our national global security is every bit important, I think, as traditional wars and conflicts. It costs as much, has as much social kinds of disruptions and morbidity and mortality. So we really need to rethink. We need to adopt One Health. We need to move upstream. We need to include One Health and zoonoses in pandemic preparedness. We're starting to do that, but we need to accelerate that. Global pandemics are destabilizing, they're disruptive. Now we have the G7, the G20, we have the United Nations, we have most all antimicrobial resistant plans globally are based on One Health initiatives. So we need to look at the strategies in all domains, including animals, environment, and plants moving forward. Emerging zoonoses are no longer some problem elsewhere. There are problems that are central to our world and way of life, and they have to be central and commensurate to our security. Next, well, we'll stay here. Sorry if we move backwards. The second recommendation, it really then talks about surveillance systems, situation awareness, getting data to find out where we are. Situation awareness is the ability then to make critical decisions and resource allegations because we understand what these diseases are doing, where they are, and the effectiveness of interventions. We value early detection for sure. Remember the epidemiology curve that if you blunt and mitigate upstream in animals, you can then mitigate human disease infections. So zoonotic and diseases, we have to shift our thinking to One Health surveillance. It's not just human surveillance, which is really important, but we have to have surveillance to look at new animal emerging diseases, plants, look at our environment and our water. And those come together and coalesce into a much better understanding of our situation awareness and what is happening. This is especially important in low and middle income countries who are so vulnerable, who don't really have these infrastructures, unfortunately, in place. So we need to collect data more broadly as we move forward. We need to have an analysis of risk factors and focus on surveillance, I think, in a much broader way. And one of the good things is that there's no technological advances, right? We now have the ability, if we collect data, and they're good sets of data, to do modeling, to do forecasting, and perhaps to do a better job of predicting where the hotspots are, where the next outbreak is going to pop up, so that we can focus our interventions and our attentions there. And then with the use of big data and AI, machine learning, natural language, we really have the ability to do that. CDC is moving on that, by the way, in human health. Next. And the third recommendation is the ability then to span our boundaries, to merge public health, animal health, environmental health, climatologists, to drive innovations, to drive discoveries. And we need to add agriculture as part of the team that will come in to help understand this and to put interventions in place. So One Health it's broad, it's multidisciplinary, it's transdisciplinary. We're adding behavior scientists, social scientists, business engineering, spanning the boundaries to devise new interventions and new strategies that any single domain by themselves will not come up with. And these are the wicked problems that we're trying to work on. They don't have yes or no answers. There's really no solutions. Their solutions are limited by worldviews, and old interventions don't work well. So new holistic teams, if you will. And the last one is to take a look at a paper from MIT on convergence science, to take a look at what they think is the third biomedical revolution after molecular biology and genomics. And that's the ability to converge scientists together in new strategies and new teams and bring relevant sectors together to establish new frameworks that integrate knowledge and fundamentally different approaches to respond to these contemporary problems. The fourth is looking at rebuilding our capacity. And we need to do that to improve our infrastructures and human capacity, not just in buildings and equipment, but also in people, their skill sets and their knowledge, and have them in place as part of a permanent workforce. We need to impart new competencies in people. Not everybody can work in this complex, interconnected world. So if you're going to work in One Health, you need some new competencies, some new leadership skills to build teams, to collaborate and work across organizational lines. A study done by the World Bank said that the cost of prevention is 2% of the cost of living with COVID if you look at a 10-year strategy. So think what it costs, to $15 to $20 trillion, and to understand if we would have spent 2% up front, we might have been able to prevent or certainly blunted this. Next. So the last solution is really creating communities of solutions. We know what communities of practice are. This is a broader to look at this. We need to build pre-existing relationships, to be collaborative, innovative, to engage stakeholders. These wicked problems and emerging zoonoses are part of society. They need to have stakeholders as part of the solutions. To build on existing institutions and organizations, you don't have to start anew, and change the context of health. And that context is much broader. And I like the idea of looking at community health organizations who've done a great deal in this country, but to insert zoonoses and certainly One Health as part of that community health and our agriculture connections as we do that, as we move forward. Relationship building is going to be critical as we move ahead, and solutions need to come from society. And lastly, there's a section in here that takes a look at agriculture and the need for agriculture to be more engaged and more involved in One Health. Agriculture is still highly vulnerable, but I look at agriculture as one of the health sciences. It is one of the health sciences. The next pandemic will almost certainly come from animals, whether they're wildlife or domestic, or could be our domestic animals and agriculture. And they need to be part of the data collection, part of the preparation, if you will, as we move forward. So I think of public health and animal health, and I'll put environmental health in now, as a single continuum. They're not separate. We don't need to look at them separately any longer. And agriculture has been a history of making great transitions and changes and greater productivity through less resources. This is another way they can do that, to add value to their product, to differentiate foods based on sustainable environment, food safety, which we've done as we move forward. In Ohio, we have teams now of smart agriculture producers, climate smart agriculture producers. And they're diversifying production with resilient agricultural models, clean water, wildlife habitat changes, carbon storage, and detecting these new transpouting and emerging diseases. Agriculture is key to our future in One Health. With that, I'm going to stop and turn it back to Ken. Thank you very much.
Well, thank you, Dr. King, for an excellent presentation. Now I'd like to introduce our panelist and our moderator, and we'll move into the next part of the program. You've already met Dr. King. Joining us also today is Dr. Bernadette Dunham, is a professorial lecturer at Milken Institute of Public Health at George Washington University, where her focus is One Health issues. Dr. Dunham served as the director of the U.S. Food and Drug Administration Center for Veterinary Medicine from 2008 to 2016. She returned to FDA in 2019, where she is currently serving an advisor in a new One Health initiative. In October of 2019, Dr. Dunham was appointed as a member of the National Academy of Sciences, Engineering, and Medicine's Board on Agriculture and Natural Resources for a 3-year term. Also joining us is Dr. Laura Kahn, the co-founder of One Initiative and a physician and research scholar on program of science and global security at the Woodrow Wilson School of Public and International Affairs at Princeton University. Her education and training span medicine, public health, and public policy. She's the author of Who's in Charge? Leadership Under Epidemics, Bioterror Attacks, and Other Public Health Crises, published in 2009 by Prager Security International. Our moderator for today's panel is Dr. Stephanie Masello-Schutte. She is the Director of Environmental Research and Dairy Management Health at Dairy Management, Inc., and serves on the CAS Board of Representatives. I would now turn the program over to Stephanie.
Thank you so much, Kent. And thank you, Dr. King, for that wonderful overview. Dr. Dunham and Dr. Kahn, we were lucky enough to have you be part of this accomplished and esteemed set of authors. And I was hoping we could just start off by quickly hearing about your perspectives or insights on this topic and this publication. So Dr. Dunham, why don't we start with you first, please?
Thank you very much, Stephanie. And again, Dr. King, that was a great presentation. I think this overall CAS publication really acknowledges the importance of taking a One Health approach to address many of the wicked problems that Dr. King presented in his talk. One Health does use a systems thinking, convergent science, collaboration across disciplines at the human, animal, plant, and ecosystem interface, and shared global surveillance systems, all of which are needed if we're going to prevent or ameliorate zoonotic diseases and future pandemics. There really needs to be a paradigm shift towards prevention rather than reaction, because that's far more costly. However, it's very hard for society to grasp, because prevention means, for example, that the next pandemic will be invisible. The World Bank stated, a pandemic prevented is a pandemic not seen. And prevention really will require forming a new One Health relationships among institutions, organizations, and countries for their global health security, food security, and sustainable development. I'm going to pass it back over to Laura now for her comments. Thank you.
Well, thank you so much. I'm truly honored to be a part of this CAST effort. And I can't top what Dr. King presented in his talk, but just expand a little bit upon that. And I think it's important that we recognize the importance of agriculture, since it is the foundation of civilization. And with the worsening climate change that threatens agriculture, we have to recognize that we had agriculture and we have civilization, civil society, because our climate has allowed it. And as we move away from the baseline climate that we've had for the past 10,000 years, our ability to feed ourselves, all 8 billion and counting of us, is going to become increasingly difficult. That in addition to emerging zoonotic diseases. Agriculture has allowed us to have food security so that we can have civilization, have institutions, and not spend all our time looking for food. I think that we need to also recognize that we live in a microbial world. We live in microbial ecosystems. Our bodies are mostly microbial. And so we need to recognize that these microbes, these zoonotic microbes, don't necessarily distinguish a difference between us and the other animals. And so One Health is inherently interdisciplinary. It inherently recognizes the blurred lines between all of the silos that we've erected between ourselves and the rest of life on the planet. These are arbitrary silos. We have to, in order to address these challenges, we need to think more interdisciplinarily that One Health facilitates. We have to break down the silos both in our organizations and in our funding to have more equitable support across the board. We need to think more proactively rather than reactively. That is how we have generally approached all of these challenges. It's kind of like playing whack-a-mole, where we're whacking each zoonotic outbreak as it emerges, rather than thinking strategically to prevent the moles from emerging in the first place. That's what we really need to do. We need to stop thinking, stop approaching all of this in a business as usual way, as Dr. King so eloquently put it. We need to figure out how to feed ourselves sustainably in a planet with diminishing natural resources, a heating and drying planet. We basically need to restructure how our society is organized in order to ensure that we are able to continue civilization. So the task at hand is immense, but we have no choice. We need to rise to the occasion, and One Health is an absolutely essential way to do it. So thank you, and I look forward to participating in the Q&A.
Well, thank you all so much. And again, Dr. King, your excellent presentation has spurred quite a number of great questions. So we'll try to get through as many as possible. The first one is for you, Dr. King. When you were talking about the need to kind of scale up animal production and food production, were those numbers, when you talked about that 120 billion animals, is that taking into account the efficiency or the advances in animal health? Or are we kind of looking just generally at the business as usual or business today model?
So those came out of an economic group, and I think they were projecting the future number of 120 billion based on today's activities. So it didn't take into account any kinds of efficiencies we might add to that.
Thank you. All right, Dr. Dunham, this one's for you. Avian influenza has been a serious problem in birds. About 7 years ago, we thought avian influenza had the potential to mutate and jump to humans. This really hasn't happened. So could you explain why? And is this kind of still a risk or not considered really a zoonosis? You're muted.
Thank you very much. It is still a risk. A major risk. This is something around the globe. We watch it very carefully. Mother Nature often determines when we're going to see this actually spill over and cause a potential issue with humans. That's why we need to monitor it so closely, and we try very much to contain it because we don't know what that next mutation is going to look like. That's why we follow it so closely. We've been very fortunate that the most recent one that we're looking at right here in North America so far has not spilled over. But it can, and that's why we need good surveillance so that we can be proactive in dealing with what will be the potential for another influenza outbreak.
Thank you. Dr. Khan, this one's for you. Do you think that more focus on reducing food loss and waste which could reduce the pressure for more food production, help when we look at this situation through a One Health lens?
Oh, absolutely. Reducing food waste could play a major factor in helping to feed the billions of us that are on this planet. And also it's important to recognize that food waste, as it's accumulated, can contribute to greenhouse gas emissions in the form of methane. So, we want to make sure that all the food that's so carefully raised and grown is actually used to provide nutrition to people and not just thrown out. So we need to have a more robust food production and system, and reduce food waste, providing that the food gets to where it needs to go.
Thank you. And I think, Dr. King, the audience was taking your look to the future to heart. This is a question for all panelists, but we'll Dr. King, what would you recommend as areas for research to PhD students or graduate students or young researchers that are interested in One Health, zoonotic diseases, and the prevention of them?
So great question. And one of the things I was going to point out, there's a group at Ohio State, where I'm at, that have named themselves as wicked scientists. So they actually have a curriculum. They actually have professors from very diverse different parts of the university that have come together, and they've decided that this is about team science. And if you're a PhD student, great, you're going to have great contributions for us, but get out of your specialization from time to time. Move around, have colleagues in different specialties in different areas, because new innovations are going to not probably come from the middle of our disciplines. They're going to come from the outside, and they're going to come from new innovations as people get together. So build your team building competencies and be able to start thinking system-wide. The Economic Forum said that the number one key issue or competence into the future is to be able to solve complex problems. Well, you can't solve complex problems by yourself. You add your discipline in with other groups. So I think about what's called T-shaped people in organizations. So think of a T, right? So we have people in organizations that are really critical, like working in a PhD in a certain structured area, and delve down and really understand that. But then to have a T at the top of that letter, and that's the ability to walk across different strategies, disciplines, if you will. And to be able to do both of those, then become, a competent wicked scientist.
Great. Anything else to add, Dr. Dunham or Dr. Khan?
I was just going to say, as we do this, you do want to expand and reach out, and we need to bring in behavioral scientists, social scientists. We oftentimes forget about the humanities, which are so critical right now on helping us explain a lot of these challenging issues. And that's the diversity that you can gain by taking this multidisciplinary approach. Thank you.
I'll just add that sometimes the best way to think outside the box is to train in one field and then go into another, so that you can bring a completely new, fresh perspective to a field with training that was completely unrelated. So, so we need to encourage interdisciplinary movement and broad training to allow us to address these challenges that really don't fit neatly into our academic silos.
Thank you all so much. And thank you to the audience for your great questions. I wish we had time to get through more, but I'm going to turn it over to Kent.
And we will be doing a follow-up to the questions that were asked that we didn't get to, along with the questions that are on there. So be looking for that in one of our upcoming publications. Again, I want to thank all of our panelists. I want to thank Dr. King. All of you are members of the task force, and really appreciate the opportunity to work with you to produce this quality publication. Somebody was asking earlier, how do I get my hands on this? You can go to our website and you look under our publication tab. It'll have a link to where you can download this free. All of our CAST materials are free, and we like to share them as freely as possible. Dr. King, Dr. Dunham, and Dr. Khan's emails are on the screen. So if you want to have any follow-up discussions with them, please feel free to do that. I want to just share with you a couple things that we're working on that we'll be sharing fairly soon. We have another new CAST issue paper on RNA interference technologies in agriculture, looking at methods, applications, and governance. We expect this will be a publication that we'll be releasing either by ourselves or in conjunction with another organization, probably sometime after the first of the year. And also, for those of you who are familiar with our Borlaug Cast Communication Awards, it's designed to recognize outstanding science communication. We are just now announcing the call for nominations on that is on our website. So if you know of somebody that you would like to nominate for next year's Borlaug Cast Communication Award, that information is available on our website now. Please check that out. We'd also invite you to join us on our social media platforms to share information or to receive information about CAST, to share ideas, to also help us in terms of this quest to how do we share the science, the technology, the innovation, all this great work that's going on in agriculture, as well as some of these wicked problems that Dr. King talked about, that agriculture may be helpful in helping find solutions. So please join us as we work through that. Thank you for joining us today. I would ask that if before you leave, at the end of this, there will be a pop-up survey. And the intent of that survey is to give us information on these types of webinars and also information about other types of topics that you may be interested in that maybe we could be looking at for as possible future publications. Thank you for joining us today. And please feel free to access our campus website, check out the paper and all of the resources. This video will be posted there in the next coming days. So thank you and have a great day.